This morning, we're joined once again by Dr. Jeff Pothof of UW, Chief Quality Officer for UW Hospitals. Doctor, great to see you again. We appreciate your time this morning. Before we get into the vaccine, and that's super important, but let me ask you about the COVID numbers right now in Wisconsin. Thanksgiving, exactly 2 weeks ago from today. Our numbers continue declining from our peak in mid-November. Hospitalizations are down some 700, active cases down 10,000, 7-day averages down nearly 3,000. So did we make it through the holiday without that significant surge?
It's looking good right now, but we're still looking at the rest of this week and into next week. We did have a couple days this week where percent positives had increased a little bit. We're wondering if that could be a sign that maybe there were some Thanksgiving gatherings. Hospitalizations are down right now. That's a good sign. It certainly would be welcome news if the citizens of Wisconsin, took our pleas to heart and held off for Thanksgiving. That would just be a wonderful thing.
So let's talk about the vaccine now with the rollout in the United Kingdom. We did learn that 2 staff members did suffer an allergic reaction. They did have a history of allergic reactions. What does that information tell you as you look towards the vaccine rollout here in Wisconsin?
We'd want to know more about those 2 cases, but it sounds like those 2 individuals had a history of some severe reactions. So, this would be reactions that would be anaphylaxis, or those reactions that someone would carry an EpiPen for. So I think we've got to be careful about that. People who have multiple allergic reactions tend to worry about having reactions to other medications. So that's a group that we should be careful about. But for most people, that won't be a problem. This isn't like seasonal allergies or some sniffles in the fall when ragweed comes out.
Talking with Dr. Jeff Pothof of UW Health. Doctor, so we're talking about frontline healthcare workers being the first really to get this vaccine. So I'm curious, how will that impact the ability of doctors and nurses to serve patients? Once they're vaccinated, does that mean that will help you with those staffing numbers because people won't have to quarantine, or at least as strictly? How will you approach that within hospitals, do you think?
Yeah, that really is the benefit to vaccinating healthcare workers, is that if they are vaccinated, they are less likely to come down with COVID-19. And right now we are struggling with a large number of our faculty, our staff, our nurses being out with COVID right now. So if they get vaccinated, less likely that they would get the disease, and that would create a more robust, healthy workforce to take care of everyone else who has either COVID or other medical problems.
And Dr. Pothof, as we learn more about the vaccine, when do you think it is realistic that the rest of us could have access to one? Because it seems as if the dates kind of shift a little bit. Based on what we know today, what are your expectations?
Yeah, no one has a crystal ball, but I would think that, pretty widespread vaccination programs will be in place probably March, certainly by April. And then it'll take a while to vaccinate, hundreds of millions of people. But certainly I think it will be available for folks looking for it sometime in March.
Dr. Jeff Pothof of UW Health. Great to see you again, Doctor. Appreciate your time very much this morning. Good luck with the continued rollout here. Best to you and your staff as well. For the latest updates on the Pfizer vaccine rollout and where you can get tested for COVID, you can head to our website, tmj4.com/coronavirus.